Hi, it's Dr. Parikh, Module 7. Sorry, the video is a little blurry that my laptop's doing. I think it's telling me it's about time to quit for the day, but I want to push through and do the last week. We're almost done. So this week, we're kind of in some ways going back to the basics that we started with in week 1 and really building and getting more nuanced views of those things. So there's a lot of focus on intersectionality. So before we leave, thinking about how different identities layer onto each other to create a different experience. And this is very important, especially given acknowledging the history of feminism as being very focused on a small group of people, upper class, well-educated white women. So this one in particular, the first one, relational race privilege and white patriarchy, that one's a doozy. It's a lot of very complex ideas, very interesting ideas, but just things that for me were very new and also very personally challenging as someone who's white. But I think it's important to approach it with an open mind. It's also fine, it's important to be skeptical, but also open. And that's a really hard note to hit. To be thinking like a scientist, to be putting pressure on some of the points, but also to be open to ideas that are critical of your identity and also to things that just are new and very different from what you're used to. Then the next 2 chapters focus on kind of different activism pieces, advocacy. Advocacy is a really big part of psychology's identity and the American Psych Association, who is kind of our biggest professional body. The idea is that because we recognize the effects of discrimination on well-being and mental health, it is essential that if we really want to do right by our clients and the populations we serve, we have to do not just individual advocacy, but also systemic advocacy for people with less power than we have. And then there's a lot of really interesting chapters in the book. There's interesting titles that I haven't read yet. There's some other ones that I've looked at that I thought were really interesting, but not quite broad enough to be important for this class or to be essential for this class. So for this last piece, I invite you to pick one other chapter that seems interesting to you. And I really hope that you include some of this in your topical post, because my hope is that you'll get to learn, from each other, from some of the main ideas. The videos for this are very short and they're very personal for me. They're about a friend of mine who did advocacy for, she works as a breast surgeon, and she did some advocacy to pass a law to require insurance companies to cover fertility preservation, maybe treatment, but to require fertility treatment for people who are about to undergo cancer that will end their fertility. And so it started with just kind of her telling a lawmaker, like, yeah, I've had a few patients in the last week or in the last few months who have really had a hard time, who have delayed treatment because they don't know what to do because they really wanted to have a family and they're young, and it's really a difficult choice. So I really just wanted to highlight that what I like about this story is that advocacy is not just about the big sweeping measures or the years-long fights. Partly it's just about letting people know about the needs of the people we work with. And I think that this is a fairly easy and smooth path in my friend's case. I think often advocacy is harder than that, but it often starts with just letting people know and raising awareness. Your assignments this week really focus on advocacy, so you're doing an advocacy project. I talked quite a bit about those pieces when I did the overview for last week. I will peek at the discussion, because I talked about the advocacy project and the plan, which is you kind of the bigger paper with the rationale and what you're going to do, and then the project is kind of just the follow-up where you tell me, here's what I did and here's what kind of came out of it. So your last post of the semester really is just kind of briefly following up with your peers on what you did and what came out of it, if anything, so far. So make sure so that one, the post is on Saturday and is due by Saturday. And then just to wrap up the course, the responses are then due Sunday. So it's this weird mix where I wanted to give you time to have the discussion, but I also recognize the class is ending. So we kind of need a cutoff date. There's the last quiz, and that's pretty much it. That's the course. It's gone quickly. It's a course I really care about, and so I hope you have grown. I hope you learned. I hope you felt like you got to share some of your knowledge and perspective as well with me and your peers. And I hope you take some of the information, but also some of the critical way of looking at society and the world and our individual development and experience too. Thanks. Bye.